I get a lot of questions, as I'm sure you have also thought about this if you're considering a surgery. How's the scarring going to be? What can I do about my scars? Can I laser it? Can I do this cream? What is going to make me become scarless? Well, the short answer is if you're having surgery and the surgery is going to be causing some incisions on your body, there's going to be some scars. However, many of these scars are pretty reasonable. You can actually drive these scars to be something that is pretty reasonable and that looks pretty nice. There's three factors that plays into how the scars are going to look like. And two of those three factors we have control over. One is what I as a surgeon do. Obviously, as a plastic surgeon, we use very delicate techniques. We use the special types of incision, we use special types of sutures to make sure that the scarring that we cause is minimized. At least we try to not aggravate any process that the body has in itself to generate more scarring. The second thing is what you do after the surgery to make sure those scars come out right. First of all, follow your surgeon's instruction. There are certain things that you have to do for your scars. There are certain times you can get them wet. There are certain activities you can do. All of those things plays into how the scar is going to develop. If you are too active too early after the surgery, the scars can widen up sometimes. More importantly, there are things that you could do such as silicone gel or tape that are well proven to help with the scars. Ultimately, if the scars don't look right, there's also other treatments such as CO2 laser. They're topical treatments which can be considered more severe scarrings, but those are rare, and most of the time we don't need to do those if we do everything else right. Finally, the third thing, which is the only thing that we don't have control over, is your genetic components. So everybody has a certain tendency to form scars, and that's usually passed down to them through their families, through their mother and father's genes. Some people we know have the tendency to form deep scars. Most of those people already has scars in other parts of their body. One way of knowing whether you're somebody who's going to form bad scars or not is to look at other parts of your body and see, from all the times that you were bitten by a mosquito or all the cuts and bruises that you had as a kid, have you developed very bad scars? If not, then probably your scarring is going to be reasonable. Also, even if you do have some scars, take it with a grain of salt. Some parts of your body can form, for example, upper chest can form scars that are different than the abdomen. So just because you also have scars in one place doesn't mean that necessarily you're going to form bad scars in the other place. So if you have any questions, talk to your surgeon and they can give you a little bit better idea as to whether that scar that you will have after surgery is going to be reasonable or not.